Hi, this is Dr. Levine, and welcome to my YouTube channel. If you're watching this video, it means that you have a rotator cuff tear that you've decided you would like to proceed with surgery. Remember, the options for management were to live with the symptoms if they were tolerable, to try the non-operative pathway, or to have surgery. At this point, you've decided to proceed with the operation, so we want to prepare you for what that's going to look like. On the day of surgery, you're going to get a interscalene regional anesthesia block. That means they're going to put your shoulder to sleep, but you don't have to have general anesthesia or have a breathing tube. They will sedate you as well, so it's sometimes called twilight anesthesia. And similar to those of you who've had a colonoscopy, you won't remember anything, but you don't have to have the breathing tube. The operation takes about 1 to 2 hours, depending upon the size of the tear. At the time of surgery, we're going to take out the inflammatory bursa. That's called a bursectomy. We're going to debride any loose tissue or any inflammatory tissue. And most importantly, we're going to repair your torn rotator cuff tendons back to the bone where they belong. That may be 1 tendon, 2 tendons, or 3 tendons. If it's 2 or more tendons, we call that a massive rotator cuff. If it's less than 2 tendons, we call that a small or medium rotator cuff tear. After the operation, you'll be placed into a sling. You're going to wear the sling for 2 weeks if you have a small tear or the medium tear. Sometimes we might use the sling for 4 weeks if you have a massive tear. We'll begin formal physical therapy 2 weeks after the operation for most tears, except for the larger massive ones, where again, we might wait till 4 weeks. Your first post-op visit with me will be at the 2-week post-op check. At that time, we'll make sure your wounds are healing nicely, make sure that you're doing well overall. We will discontinue use of the sling for the small and medium-sized tears. We will begin formal physical therapy for the small and medium-sized tears. The goals of the first 3 months, what we call phase 1 of your recovery, are to regain your range of motion, your flexibility, while the rotator cuff repair heals. And it does take 3 months to do so. Phase 2 begins from month 3 through month 6, and that's where we work on strength and functional recovery. Your second post-operative visit with me will be at 4 months post-operatively. At that time, you'll have had all of the first 3 months of phase 1 to regain your range of motion, regain your flexibility, and have 1 month of strengthening in phase 2. So you should be pretty good at that visit. You should have full range of motion. You should be using your arm for all daily activities, and of course, be very functional with the arm. Remember, it takes up to 1 year for full recovery after any shoulder surgery, so we're not expecting you to be normal by any means. Post-operative visits after 4 months are on an individual basis. Some patients don't need any other visits and some do, and we'll go over that with you based on how you recover. I hope this is helpful for you as you plan to have your upcoming rotator cuff repair surgery. Please let us know if you have any comments, questions, or concerns. And this is Dr. Levine, again, thanking you for coming to me for your care, and we look forward to taking care of your pain, improving your motion, function, and strength. Have a great day.